We then went through 3 weeks of additional screening to ultimately find out we were excluded. So I'm curious, like, what is it like behind the scenes?
Yeah, it's frustrating. I share your frustration. Most of the time when we have a patient that we're trying to put on a trial, we're advocating for the patient to go on the trial. And I think there's a natural balance between the providers and the trial sponsors. The trial sponsors want the cleanest trial they can get. They don't want any biased things. If that lung inflammation really did come back in their trial and then it says, oh, it's due to their trial drug, well, they don't want that in there if it really wasn't due to the trial drug. So I get it. But a lot of times the delay is the clinician saying, I don't think this is relevant. And maybe the trial sponsor is saying, well, maybe you don't think it's relevant, but we see it there, hard to exclude it. The trials do want to include all people that are, reasonable to be in the trial, but they also have to protect the integrity of the data to make sure that it ends up being interpretable. And most of the time, you'll read these inclusion criteria and these exclusion criteria, and they sound really black and white. And a lot of times they're not. I mean, I was on correspondence today about a patient who has a small radiographic abnormality on their MRI. There's like a little white dot. And the radiologist is like, could be a brain metastasis. Not really sure. It's just a tiny, small artifact in there.
This sounds really familiar because this actually happened to me.
No, but this is a common thing. Like, you see this small abnormality and it's like, can you say it's not a brain metastasis? And you're like, well, I can't say it's not.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit CrackingCancer.org to join the Cracking Cancer community.